Hi, I just wanted to do a quick piece talking about the current conventional medical system, allopathic medicine. People who are part of the American Medical Association. I have had very little contact with doctors, except for when I was a kid. And when I was a kid, they'd look at your eyes, they'd look at your tongue, they'd do other kind of look in your ears, and it was just like standard procedure. They kind of checked things out and listened to what was going on, checked your heart and stuff. In most of my late teenage years and 20s and 30s, I haven't had health insurance. My day jobs just haven't had it in the past 20 years. So I just took care of my own health things by, trying to eat right and so forth. Recently I've had some health issues come up, and so I went to, after a year of doing conventional or alternative stuff, I went to a conventional doctor, or a series of conventional doctors. And on average, the appointments lasted 10 minutes. It appears that after the assistant took blood pressure, and also in the past, the doctors used to take our temperature. Anyways, after the assistants have done their preliminaries, the doctor comes in and almost seems to have a conclusion before they even look at the patient. My question is how is a doctor supposed to know what's going on in 10 minutes of just talking with the patient? I have had two other family members with severe health problems, and they're attending going to conventional doctors, and they both have ended up in the hospital for various reasons due to negligence on the doctor's part. And it's mean to try to sue a doctor, my family members are just all their time is spent working and just recovering from work so they could go back to work so they could pay their rent and bills. So what I don't understand is, and in my situation, in that 10 minutes, the doctor says, you're fine, nothing's wrong with you, even though I feel like crap. That doctors feel that it's okay that they think that there's actually some accurate diagnosis that they've done. It just seems idiotic. These people, they seem college educated, they seem somewhat intelligent, and yet they're disregarding the patient feedback and multiple patient feedback. So I'm seeing an endocrinologist, and he's like, I have tons of people coming in with your symptoms, and there's nothing we can do. And I'm just I'm reading books, from the library, and they're talking about various things, adrenal fatigue or candida, B vitamin deficiency, malabsorption, digestive problems, low hydrochloric acid, copper toxicity, hypoglycemia. So there's all these somewhat. You can push through and function. You can function with a low quality of life, but you could still get up with all of these conditions. And there's even documentation in the medical literature about these things. Yet these conventional doctors are content with just giving a 10-minute interview with the patient, telling the patient everything's fine. Unless, the patient has, a huge gaping sore, it looks like our doctors are just leaving us to our own devices. I'm up for, taking responsibility for myself. I would just like some validation about my situation and recommendations. These people are dealing with adrenal fatigue or candida, so it would just be nice to know what has worked, in the hundreds of patients that they've dealt with. Because, I'm trying to figure it out, and it's overwhelming. Some people say do this. And so my conclusion from all this, and reading various books about various health problems, from irritable bowel syndrome to adrenal fatigue to hormone imbalances, is that conventional doctors are allowing ourselves to die. They're allowing our conditions to become extremely exacerbated, to where eventually we'll end up in the hospital and, maybe have to be on medications for the rest of our life. It seems pretty crazy, but that all these doctors, and maybe they are concerned about, if they actually do something that is preventative, that they're going to be chastised. I think, that is a legitimate concern. I would just like it if the doctor said that. I would like it if the doctor said, I can only do what is legally required by the AMA. So, you probably have this, or I just can't tell you, rather than make it seem like I'm this complaining person, along with millions of other complaining people. My final thought or question to the AMA and conventional doctors is, have you lost your mind? Like the Hippocratic Oath is do no harm, be helpful, rather than be absent or negligent. So, those are my thoughts. Feel free to rate this monologue. Thank you.